The global discussion surrounding healthcare systems frequently centers on a fundamental dichotomy, universal versus private models. This debate is not merely academic. It profoundly impacts individuals and national economies. At its core, the central question revolves around who ultimately bears the financial burden of healthcare provision. Both universal and private systems inherently involve significant costs. Healthcare is a complex and resource-intensive sector, requiring substantial investment in infrastructure, technology, and human capital. The critical distinction lies in how these costs are distributed across society. The distribution of these financial obligations varies dramatically between the two models. This difference in cost allocation has far-reaching implications for access, equity, and overall public health. Understanding these mechanisms is crucial for informed discussion. The overall impact on individuals and the broader economy also differs significantly. Each system presents a unique set of advantages and disadvantages regarding financial security, health outcomes, and economic productivity. This analysis will explore these distinctions in detail. Private healthcare systems primarily operate on a market-based approach. In this model, healthcare services are largely treated as commodities, subject to the principles of supply and demand. Providers compete and consumers purchase services, often through insurance. Individuals typically pay for their healthcare through insurance premiums. These premiums are regular payments made to an insurance company in exchange for coverage against potential medical expenses. The cost of these premiums can vary widely based on factors like age, health status, and coverage level. Beyond premiums, individuals frequently incur out-of-pocket expenses. These include deductibles, which are amounts paid before insurance coverage begins, and co-pays, fixed amounts paid for specific services. Co-insurance, a percentage of the cost, is also common after the deductible is met. Furthermore, individuals often pay directly for services not covered by their insurance plans. This can include elective procedures, certain medications, or services deemed non-essential by the insurer. Such uncovered costs add to the individual's financial responsibility. Consequently, the financial burden in a private healthcare system is primarily shouldered by individuals. Their ability to access care is often directly linked to their financial capacity or the generosity of their insurance plan. This places significant personal responsibility on the patient. Employers also contribute significantly to insurance plans in many private systems. They often subsidize a portion of employee premiums, making health coverage a common benefit of employment. However, this employer contribution is often viewed as part of the overall compensation package. This system can lead to higher costs for those with pre-existing conditions. Insurers may charge higher premiums or deny coverage altogether, making it difficult for vulnerable individuals to secure affordable care. This risk stratification can create significant barriers. Similarly, individuals who cannot afford insurance face substantial financial challenges. Without coverage, they are responsible for the full cost of medical services, which can quickly lead to overwhelming medical debt. This creates a significant disparity in access. The financial constraints inherent in private systems may result in delayed or foregone care. Individuals might postpone necessary treatments or preventive screenings due to concerns about cost. This delay can lead to more severe health issues and higher costs in the long run. The market-driven nature of private healthcare can incentivize providers to prioritize profit. Hospitals and clinics operate as businesses, aiming to generate revenue and manage expenses. This focus can sometimes influence treatment decisions and service offerings. This profit motive also carries the potential for inflated prices and unnecessary procedures. Providers may charge higher rates for services or recommend additional tests and treatments that are not strictly necessary. This can drive up overall healthcare expenditures. Universal healthcare aims to provide healthcare access to all citizens. This fundamental principle ensures that every resident, regardless of their socioeconomic status, has the right to receive necessary medical attention. It is a commitment to health as a public good. access to care is provided regardless of an individual's ability to pay. This means that financial barriers are largely removed at the point of service. Patients can seek treatment without immediate concern for upfront costs or insurance coverage. Universal health care is typically achieved through government funding. The state plays a central role in financing and often regulating the healthcare system. This centralized approach allows for broad oversight and strategic planning. Funding for universal healthcare is often sourced through taxes. This can include income taxes, sales taxes, or dedicated healthcare levies. Citizens contribute to a collective fund that then finances the entire healthcare infrastructure. Therefore, the financial burden is distributed across the entire population. Everyone contributes through their tax payments, creating a shared responsibility for the health of the community. This contrasts sharply with individual premium payments. Everyone contributes, even those who may not use healthcare services frequently. This collective contribution ensures a stable funding base and embodies the principle of social solidarity. It means the healthy help subsidized care for the sick. Universal healthcare systems can lead to lower administrative costs, centralized billing, standardized procedures, and reduced need for complex insurance claims, processing streamlined operations. This efficiency can free up resources for direct patient care. These systems also benefit from bulk purchasing and negotiation power. Governments can negotiate lower prices for medications, medical equipment, and services due to the sheer volume of their purchases. This leverage significantly reduces overall costs. Unrestricted access promotes preventative care. When individuals do not face financial barriers, they are more likely to seek early diagnosis and preventive screenings. This proactive approach can avert more serious and costly conditions later. This emphasis on preventative care holds the potential for long-term cost savings. Addressing health issues early prevents their progression into chronic or acute conditions, requiring expensive interventions. Investing in prevention yields future dividends. A fundamental distinction between the two systems lies in the concept of the risk pool. In private healthcare, the risk is concentrated among those who purchase insurance. Insurers pool the risks of their policyholders, and premiums are calculated based on the expected health costs of this specific group. Conversely, in universal healthcare, the risk is spread across the entire population. Every citizen contributes to the system, effectively pooling the health risks of an entire nation. This broad base includes both healthy and sick individuals, young and old. Spreading risk across a larger, more diverse population allows for greater financial stability. The impact of high-cost cases is diluted across millions of contributors, preventing individual financial ruin. This collective approach smooths out financial volatility. This broad risk spreading also allows for greater financial predictability. With a larger and more stable pool, governments can more accurately forecast healthcare expenditures and allocate resources. This predictability aids in long-term budgetary planning and resource management. In both universal and private healthcare systems, everyone ultimately contributes financially. There is no truly free healthcare. The costs are simply distributed and collected through different mechanisms. The question is not if, but how individuals pay. In private healthcare, individuals pay directly through premiums. These are explicit, regular payments made to an insurance provider. The connection between payment and service access is clear and immediate for the individual. They also pay directly through out-of-pocket expenses. Deductibles, co-pays, and co-insurance are direct payments made at the point of service. These costs are immediately felt by the patient when they receive care. In universal healthcare, individuals pay indirectly through taxes. These contributions are integrated into the broader tax system, making the link between individual payment and healthcare funding less direct. Taxes fund a wide array of public services, including healthcare. Universal healthcare aims to spread the cost more equitably. By funding through progressive taxation, those with higher incomes typically contribute a larger share. This mechanism seeks to reduce the burden on lower-income individuals. This system ensures access for everyone, regardless of their current financial situation or health status. The collective funding model guarantees that essential medical services are available to all citizens when needed. It prioritizes universal access over individual payment capacity. Crucially, universal healthcare prevents the financial burden from being disproportionately borne by the sick or the poor. It acts as a social safety net, protecting individuals from catastrophic medical debt. This collective responsibility mitigates the financial risks associated with illness. The debate over healthcare systems involves considerations far beyond direct financial costs. It encompasses societal values, economic productivity, and public health outcomes. The choice of system reflects a nation's priorities. Universal healthcare can lead to improved public health outcomes. By removing financial barriers, it encourages early intervention and preventive care, leading to a healthier population overall. This proactive approach benefits society as a whole. It can also result in significantly reduced medical debt. Patients are less likely to face bankruptcy or financial ruin due to illness, fostering greater economic security for individuals and families. This protects citizens from unforeseen health crises. Furthermore, universal healthcare can contribute to increased economic productivity. A healthier workforce is a more productive workforce, reducing absenteeism and improving overall economic output. It also frees individuals from the stress of medical bills, allowing them to focus on work. Private healthcare, while potentially offering more choice in providers or specific plans, can lead to financial insecurity for many. The risk of high out-of-pocket costs or inadequate coverage can create significant anxiety and economic instability. Choice often comes with a price. It can also lead to stark disparities in access to care. Those with limited financial resources or inadequate insurance may struggle to obtain necessary medical services. This creates a two-tiered system where quality of care is linked to wealth. The who really pays question is, therefore, complex and multifaceted. It is not a simple matter of identifying a single payer, but rather understanding the mechanisms of cost distribution and their broader societal impacts. Both systems involve contributions from everyone. The answer ultimately depends on the specific design and implementation of each system. Variations exist within both universal and private models, influencing how costs are collected, managed, and distributed. Nuances in policy can significantly alter outcomes. Finally, the answer also depends on the values and priorities of the society in question. Whether a nation prioritizes individual choice and market efficiency, or collective responsibility and universal access, shapes its healthcare system. This choice reflects fundamental societal beliefs.